Hi, I'm Chern, CEO of Bridge Alliance. So I'm pleased to introduce today a series of Be in Conversation, a platform where we speak to our member operators, partners, and customers to spark off ideas and to deepen our collaboration to propel our industry forward. I'm very pleased to have with me today Dr. Yong Chern Chet, COO of Good Doctor Technology. Hi, Dr. Yong.
Hi,
Welcome to our Be in Conversation series.
very happy to be here.
Right. So I understand that Good Doctor Technology is a joint venture between Grab and this one of these largest health tech company in China called Ping An Doctor.
Yep.
Right. Maybe you can share with our audience a bit more about your company and your aspirations.
Yes, of course. So the idea was born about providing access to healthcare. So the fact that Grab is the one of the largest online to offline platform in the region,
Right.
and then you have basically our other joint venture partner, which is Ping An Good Doctor. So they are literally the biggest health digital platform in China as it is. So when you think about it, you marry technology and know-how of industry
Right.
with great access into the region. So that is basically the combination and the strategy behind Good Doctor Technology,
Right.
which is the startup that I'm with right now. Yeah.
Very interesting.
Mm.
So if you look at what your company is aspiring to bring to the industry,
Okay.
it's a bit of disrupting the norm, right? Because that's not how we view healthcare services or wellness services. So what's your view about the role of technology in what you're doing?
Okay, so maybe how I would frame it is we all are very familiar with healthcare being delivered through our traditional healthcare infrastructure. So
Right.
namely the clinics, the hospitals, and basically the physical facilities. Where we have identified a pain point in the region is that access to doctors is still a problem, meaning doctors are usually located in core urban areas and they're not distributed throughout let's say, the country, right? So Singapore is a different story because Singapore is actually very compact and accessible. But
Right.
the moment you go out into the other Southeast Asian nations, access is actually a problem. So we are using digital and we're using connectivity and technology such as AI, online offline models to actually I would say tackle the problem of access.
Right.
Meaning in the world of the healthcare, we have this thing called iron triangle. So what it says is the 3 points of the triangle, access, cost, and quality, cannot all be delivered simultaneously. So because of this, we feel that by bringing the operations and the services from the physical world onto the digital world, we are actually able to address all 3 points simultaneously.
Right. Very interesting. So this triangle, right? You call it
The healthcare
the
iron
healthcare
triangle, yeah.
iron triangle. And I sort of can relate to it because in telco, it's very similar,
Oh,
right?
okay,
About
yep.
access, connectivity, right? So how do you see telco playing a part in what Good Doctor is trying to enable, right? This transformation of the healthcare industry.
Okay, that's a very good question actually. So how I will frame it is I'll use this keyword called trust for us to understand the concept. So I think number one, a key area where we require trust is basically in what we call identification and authentication. So you can recall every time you go and see a doctor, a lot of the processes start by determining who you actually are
Right.
and whether or not you are the right party that we're dealing with. Because you can imagine all the medical safety procedures are all linked to that.
Right.
So that's the first aspect of trust. Second aspect would be as we bring all our data and our processes from offline to online, we need to be able to protect the privacy and the security. So we're talking about cybersecurity and basically data privacy, which is increasingly becoming very important in healthcare
Right.
because of the whole digitization process. I think lastly is we're talking about capability and reliability. So it's more of a capacity and supply conversation. You can imagine that, when you build a hospital, your systems have to be reliable. They have to not fail because you are running a lot of critical processes on this infrastructure. Now imagine we are trying to bring healthcare out of the hospital, either into the home or onto an online platform. So with that said, the infrastructure that we run our processes and our services on have to be equally reliable and capable. And of course, lastly, as a digital startup, it's about scalability.
Right.
So I think that's where it connects back to what the telcos are providing in that area of
Right.
service. Yeah.
And as we move into the 5G era, right? So as a person in the telco industry for so many years, we are very excited about the possibility that 5G can open up. Do you see that as sort of giving you new opportunity and new possibility also in the healthcare area?
Yes. Okay. So if you think about the fact that we are trying to create or deliver health services and offerings from within a physical environment to, let's say, from outside. So meaning we are actually trying to begin your health journey before you even have to go to the hospital. And in fact, you end your journey maybe even outside because you are maintaining chronic disease or you're trying to monitor a certain recovery.
Right.
So for us, what it means is we are delivering healthcare from, in fact, anywhere, right? Whichever is convenient for the patient. So in that case, I like to use this, a quick analogy. We are keen about anything that we can do remotely, right? That means distance will no longer be a barrier to our service delivery.
Right.
Number two, it's about real time. Because if you think about it, when it comes to health, you cannot have a situation where, let's say, there's a change in the status of the patient and it's not picked up or it's not sensed until much later on. So real timeness for us is a great asset in terms of how we deliver healthcare. And I think lastly, I mean, from what I hear about 5G, it's really fast. So when you think about it, speed is also essential because you really want to be responsive and you want to be able to detect changes in status, right? So remote, real time, and really fast. So I think that's how
3 hours.
I like to look at what 5G is enabling for us in the healthcare space.
Right, yeah, very interesting. So if you look at this 3 Rs that healthcare is really looking forward to, right? Telco actually has a key role to play, right? To really deliver these 3 Rs that you're talking about. And today when you deliver your services, right, from Good Doctor Technology,
Right.
are there areas that you think telcos, because telcos are very much focusing on specific markets,
Okay.
and Bridge Alliance is where we bring the telco community together, right, to work together and to deliver cross-border kind of services.
Right.
So where do you think Bridge Alliance with our community can actually enable your vision, right? And going forward into the 5G area where your 3 Rs matters, right? We can do better by being a good partner of Good Doctor Technology.
Okay. Well, so if you compare to what the traditional approach is, normally for us to render health services, we always need to ensure that we are running on infrastructure,
Right.
such as clinics or hospitals. But the fact that if we want to digitize the health delivery system, we need a other form of infrastructure to actually run our services on. So I see telcos as being literally the digital infrastructure that is outside of the health system. So that way, for us, we can go onto a reliable support system, or let's say a trusted partner, in order for us to build our services. And as a regional startup, we actually have ambitions to, let's say, expand from where we're currently operating, which is Indonesia, into, let's say, Thailand, and subsequently maybe country number 3, number 4, and so on, right? So as we go into the region, I think working with the local telcos in each of the geographies will be a great asset, and Bridge Alliance being the interconnected party,
Right.
I think that will be a great partner to work with, because then we can standardize our approach. And I think all this will actually deliver better outcomes for our users or patients in the end of the day.
Right.
Yeah.
Thank you. Thank you, Dr. Yong. I think it's very enlightening for us to look at how technology and the partnership between telco and enterprises can actually bring about the future, right, of emerging technology and translating it into a better way that consumers can live, play, and work. So thank you again, Dr. Yong, for joining us today at Bridge Be in Conversation.
Yep.
Thank
You're
you.
welcome, Gochu. Thank you.